I am moderating this panel of amazing humans today. Thank you again for the opportunity. Again, I'm Dr. Mandy Sanchez. I'm the program coordinator for Culture Reframed and the project lead for our CR-CAC working group. We are creating materials and resources for CACs and allied professionals in the US and around the world. And it is my honor to introduce our panel. First, we have Heidi Olson, RN, MSN, CPN, SANP, is a certified pediatric nurse and certified pediatric sexual assault nurse examiner. She is also the founder and president of Paradigm Shift Training and Consulting, which equips healthcare workers with skills and tools to be able to identify and treat victims of trafficking and exploitation. In 2019, Heidi implemented an evidence-based screening process in an emergency department, which has resulted in hundreds of vulnerable children being identified as victims of exploitation and trafficking, and is currently expanding this work globally. Heidi has presented hundreds of times internationally about sexual violence, pornography, exploitation, and human trafficking. Heidi is also a clinical consultant for Culture Reframed and is working on creating resources for clinicians who are caring for children who are struggling with the harmful effects of pornography. Heidi recently won the Cry Purple Award, which is given to citizens who are doing outstanding anti-trafficking work. Congratulations, Heidi. Next, we have Louise Barraclough. She is a lead nurse and safeguarding lead for the Devon and Cornwall Sexual Assault Referral Centers, both the pediatric and adult service. Her clinical background prior to safeguarding and SARC was in reproductive and sexual health, predominantly with young people, and she has worked collaboratively with multi-agency partners across the Southwest Peninsula of the UK for many years to proactively facilitate collective CYP-focused practice. Her specialist interest and research focus on all forms of violence against women and children, particularly sexual violence and exploitation, where health services, and in particular nurses, can make a profound difference in leading patient-centered and trauma-informed care. She works with multi-agency partners, safeguarding children partnerships, and police colleagues to interrogate the root causes of violence against women and girls and the current strategic frameworks and legislation that determine and sometimes restrict systemic and agency responses. And then we also have Joshua Bissell. He is the program director for CACMI in Michigan. Joshua is committed to providing support to CAC leaders and their staff across his state. In addition to helping members prepare for accreditation and reaccreditation, his support ranges from on-site training to phone consultations, active troubleshooting of difficult dilemmas, and planned delivery of content expertise and practical advice. His personal mission is to ensure that every CAC staff person has an opportunity for professional development and growth as experts in their field, and to foster a collaborative network where even the smallest programs feel supported. In a previous life, Joshua worked as a licensed social worker in the state of Louisiana, developing a social services program embedded within the New Orleans Police Department Special Victims Section. He spent years working with child abuse, adult sex crimes, and domestic violence units, and served as a forensic interviewer and case manager at the New Orleans Children's Advocacy Center. He received his master's degree in social work at Tulane University. First, thank you so much for all of your presentation, your work in this field. And now we are going to begin. And we'll start first with Heidi. This question is, what are you seeing in your work about the effects of pornography on young people?
Yeah, so just to give everyone some context, I'm a sexual assault nurse examiner, which means I see kids who have been victims of sexual assault or some type of sexual violence. And I was just reading through all the comments, and I completely agree with everything you're saying in that it feels really overwhelming at times. And also it's really validating to be around people who are seeing the same trends and who are wanting to be proactive in raising awareness. So I'm thankful to be here. But I was trying to think through, how do I adequately explain the way pornography is tied in with child sexual assault? And it's difficult. And these two things are so linked and becoming more and more and more linked that I think the best way that I can do it is just to give you a few examples of what I've seen recently. And so we see, first of all, a lot of kids who are perpetrating sexual violence against other children, where pornography is absolutely a piece of the puzzle, where the perpetrators are viewing pornography, then they're acting it out. But we're also seeing it play so many other roles. So I just want to tell you quickly about 3 patients I've seen recently. These are not the worst cases I've seen. These are not outliers. Like, this is kind of what we're seeing frequently around the United States. So I took care of a 17-year-old a couple of months ago. She was being trafficked. She was being sold in a hotel, and her 21-year-old buyer, who was sexually assaulting her, was live streaming on Instagram. This 17-year-old's boyfriend saw this on Instagram. He called her mom. Of course, her mom freaked out. She called law enforcement, and law enforcement ended up bringing her to the hospital where I was talking to her. The disconnect that's happening with adults, right? So we see this level of pornography happening with her assault, with her trafficking, is that everyone around me is kind of saying, oh, she's choosing to do this, right? So we're totally just not understanding really in society what's going on. But there's sort of that. That's one case. Then a couple of days later, I saw a 4-year-old. She had been sexually assaulted by her 13-year-old brother. So as I was talking to her mom, of course, this is extremely traumatic for everybody who's involved. The mom was telling me, yes, her 13-year-old brother has been looking at pornography. We have seen it on his phone. He's also sexually acting out in other ways. He's been having sex with like these 16, 17-year-old females, and he's assaulting his sister. Mom, of course, was very concerned. Dad was saying, I don't think it's a big deal. It's fine for a 13-year-old to be looking at porn, and I think the 4-year-old's making it up. So then we're dealing with this dynamic, right? And then the next patient I see a couple weeks later is a 14-year-old. She snuck out of her parents' house to have sex with an 18-year-old she had met online. When the parents discovered she wasn't at home, they called law enforcement. Law enforcement found her, brought her to the hospital. So at the hospital, her parents are looking through her phone, and Dad, of course, he's in tears. He's devastated, and he's saying she's talking to over 30 adult men online on these different apps, sending naked photos, sending naked videos, saying these horrifically, like very sexually horrific things. So Dad's like, how did my 14-year-old daughter learn how to do this? And I mean, just a minute, like, it's porn. It's porn. Whether she's watching it and emulating it, or these adult men are teaching her what to say, this is a very pornified thing that you're seeing. And I remember the dad sitting there saying, oh, I didn't even think about the fact that my 14-year-old might be looking at pornography. And of course, there were other factors going on in this family, but we absolutely saw not only is she creating child sexual abuse materials and sending it to these adult men who are asking for it, but likely they're either grooming her or she's learning what to say in these very hyper sort of sexual situations, and then meeting up with adults online. So online, I mean, she's not online, in person. So this is what it looks like kind of in the day and the life of frontline responders, that we're seeing porn influence so much of this. And I mean, I could go on and tell you hundreds of stories that are like this over and over. And so these two things are very, very much linked.
Well, thank you for sharing that experience. And I know, because you and I talk often about those experiences of you being in the ER and getting another case. And it just seems like every time you're going in, you're hearing about that connection and seeing it in your work. Thank you so much, Heidi. Louise, would you like to follow up on Heidi's response and let us know what you're seeing in your own work about the effects of pornography on young people?
Yeah, and I think the key thing here is that Heidi and I never knew each other before Gail introduced us, but the minute we met, we said we are seeing exactly the same thing. So you're talking about Heidi in a city in the US and me on the Southwest Peninsula of the UK seeing exactly the same thing. So that tells you something. From my perspective, this has been bugging me since 2009, 2010. Our kind of bread and butter in sexual health services with young adolescents was the standard questions. They come in, they say, I'm madly in love, I want to go on the pill, I want to have sex with my boyfriend, can you give me some condoms? And it started to change. The question started to change to, my boyfriend wants to have anal sex. Is everyone else having anal sex? And it just built from there. And what really struck me was that young people were navigating this kind of no man's land between what they actually desired, what they thought was expected of them, and what they thought everybody else was doing. And the whole thing was becoming a complete muddle. So that's been bugging me. And then within our child sexual abuse assessment service, I had a gut feeling that a lot of what we were seeing was children, young people who were being sexually harmed by other children and young people. So I did a quite detailed research study around it, and it is 40% of what comes through our service. So to give you some context, last year we had 1,700 children referred in, so 680 of those were sexually harmed by another child or young person. And the most common age of both the victims and the harmers is 14. So what I looked at was all the case files that we held, that children's social care held, that police held, to look for acts commonly seen in pornography. And I found those acts in 29% of the cases. Those acts included non-fatal strangulation, unwanted and forced anal sex, slapping, name calling. And one of the most common themes that ran through it was young women, so teenage girls, saying, I was really happy with the foreplay. I wanted to have sex with him, but I didn't want anal sex. I didn't want to be choked. I didn't want to be called these names, but I didn't know how to stop it. And I think what my hypothesis is, and I'm not claiming any causal link here or anything like that, but pornography is serving up this menu of acts that young people are being told this is what sex looks like. And it's just making it impossible for both the girls and the boys to unpick it all and to know. It's just muddied the waters so much. So seeing exactly the same thing.
Thank you so much, Louise. Yes, it's really amazing how that we're seeing this everywhere from all over Europe, the US, in Mexico and everywhere. Josh, I'm gonna hand it over to you. You can shortly respond to that about what you're seeing, but also what you're doing right now to address the effects of porn on young people.
Sure. Real quickly, this is a challenge. To be really brief, I agree with Heidi. What I'm seeing is there is litigation to protect children, even from the impact of being exposed to pornography. There's lewd and lascivious conduct. I don't know what the statute is in whatever state or country you're listening in from today is, but there are examples of legislation that protects children, but there's not the prioritization of uplifting those laws in the hands of those who are responsible for the prosecution of children. I think we see other things sort of drown out these charges, and so whatever we can do to just work with our local officials and with our states, our governments, to impress upon them how this is a priority. And there's already infrastructure to hold people accountable. I think that's what I'm seeing. That's the right step. What am I doing? Well, I think most notably working with Culture Reframed now to try to build better guidance for professionals. I think locally in Michigan, I get the privilege of working with all the children's advocacy centers around the state. And what I'm trying to do is encourage the application of safety assessments. So typically children's advocacy centers are really only responding to outcries that are either child-led or adult-led, typically pursuant to a criminal investigation. And so you really only see a handful of programs that will really encourage or adopt more of a safety check process where we can do good screening. We can identify use of electronic devices in the home. What does social media access look like? And really do some safety work. scoured the participants list on the Zoom call when I joined. So I've got to give a shout out because my friends from Traverse Bay Children's Advocacy Center are here. And they actually lead in our state, I think, as like an example, a model example of what safety assessment can look like. So for me, what we're trying to do is encourage teams to develop capacity, because sometimes it's a capacity problem, but to build programming, build pathways for families to come to our centers to seek guidance and assistance when they're when they have concerns. They don't necessarily have a reason to believe something's happened to their child, but they just have concerns. I think the other thing that we're looking at is trying to take the tools we're already implementing to support professionals. So forensic interviewing, peer review, and like consultation work and like the training we're doing for new interviewers. Are we focusing case criteria on things like exposure to social media, or the use of electronic devices in peer review? I think so often we focus on, again, the things that we see more often, those criminal referrals, that we lose out on a lot of interviews that never really get to a criminal act, and they're kind of spent in safety and explorative sort of content. So, I think what I'd like to do is spend more time formally in peer review looking at exploratory interviews, like make that the topic of choice when you're setting like your submission requirements. I think the other thing we're doing, and this is something anyone, I can speak at the very least for the United States, is that you're participating with your Internet Crime Against Children task force. Just about every state has one, and I'll drop a link in the chat box here in a second so you can find out where that is in your state. But make sure you're involved with them, at the very least, to get access to like up-to-date information, and see what is actually already happening, so that we're not duplicating efforts and we're working together. We're stronger together. So.
Perfect. Yeah, well, as a researcher, I love that call for research and making that a priority too, because I think that that's so important. Heidi, would you like to follow up on Josh's response there about what you're doing in your work?
Yeah, so a few years ago, once we really started seeing this link between pornography and sexual assault, kind of in whatever way it was influencing the sexual assault, we realized it's really important to ask our patients about it. Of course, we're only asking kind of our adolescent age range. But what has happened in asking kids, and we're asking them about their sexual assault, we're assessing them for exploitation, like it really just kind of fits in with all the questions we're asking anyway. We're building rapport. We can spend a long time with our patients. So SANE nurses really have a unique ability to be a safe place to ask these kind of questions. But what we found is just the disclosures that were coming out when we asked a few simple questions around pornography was just mind-blowing. So to give you an example, we had a 12-year-old a couple of years ago. She came in after a horrific sexual assault where a 16-year-old had sexually assaulted her in a parking lot. And she did not think that she had been sexually assaulted. Now, of course, she couldn't consent to it just based on her age. But as we were talking through, why she didn't view this as a sexual assault when it obviously very clearly was very, very violent, our nurse started to ask her about pornography, and she disclosed that her parents had given her an iPad at the age of 5. They had never checked to see what she had been viewing. She had accidentally stumbled onto pornography. And she told our nurse, I've been looking at pornography and masturbating to it every single day for the last 7 years. And now, like, my brain hurts when I can't. Like, I have to do it every single day, right? This 12-year-old's plan. So then to her, it's not a big deal when this 16-year-old is strangling her and harming her because she's been watching it for the last 7 years. And so our nurse asking that question for us made us start to say, okay, of course, this child's been a victim of a crime, but also, how do we address the problematic porn use that's going on now as well? And it's been going on for a long time. So asking those types of questions for us has been really, really eye-opening. But what we're seeing is that this can apply to a lot of healthcare settings, right? It doesn't only need to be SANE nurses, because we see such a small population of, patients in general, like primary care physicians and teen clinics and lots of other places absolutely can start to ask these types of questions. And I think the disclosures are really going to be mind-blowing when we can implement it, because there are a lot of kids who are struggling silently and not saying anything to the adults in the world about what's going on.
Right, Heidi, I think that's so important that you mentioned how this can expand from, from SANE nurses to the multidisciplinary teams that we see in CACs to physicians' offices. That's a really great point. Okay, Louise, so would you like to address both what you're doing in your work and then what you would like to see happen in the future to address this? So future goals, if they're not being implemented right now.
Yeah, so I think it falls for me broadly into two categories. There's upstream about all of this, and porn critical sex education is to me a no-brainer. It has to happen. I don't know how it's all set up in the US. It is mandatory sex education in the UK, but it's not, there's no mandate as to what needs to be in it or who provides it or who delivers it. So there's no consistency there. And yeah, the porn critical side of it is not happening enough. I think we need targeted work with boys and young men to counteract. We need a counter narrative to what's going on. And I think one really good example from the research that I did was the social workers had spoken to some 11 and 12-year-olds that said, and this was repeated over and over again. They said, I know I'm not meant to watch porn. My mum and dad have got parental controls on my devices at home. I know I'm not supposed to watch it, but all the boys are hotspotting their phones in the playground. And if I don't watch it with them, I cannot be part of the friendship group. And that's at an age where being part of your friendship group is a matter of survival, isn't it? So expecting individual boys to opt out is too much to ask of them. I think the assessment tools that we still use are not fit for purpose anymore. If you read all of the assessment tools in the UK that talking about pornography with children, they still require professionals to define what's exploitative, what's hardcore, what's illegal, what's violent. And we know it all is. That's mainstream now. I think we need some heavy duty industry regulation. And I know Gemma and Joe are here today. So they run CEAS UK, and they've been instrumental in getting age verification put into the Online Safety Act in the UK. They've done such a brilliant job. I think downstream agency responses like Heidi's just talking about, everybody's got a part to play in this. And particularly in the older age group of that research study I did, 70% of those who had harmed were not spoken to by anybody. It was a complete reliance on the criminal justice system. So it was up to the victim to do all of the work and engage with police. Otherwise, nobody spoke to these boys, to these adolescent boys. And that was not like that in the younger age group. In the younger age group, the agencies were saying, oh my goodness, why has he done this? We must talk to him. We must find out what's going on in this boy's life to make him behave this way. Once they got to 11 or 12, nobody spoke to them. What that's about, I'm not quite sure. So I think for me, this is to me a child protection issue. And you hear, and I know people have put lots of stuff in the comments and stuff like that, and we've had the same problem in the UK, the free speech lobby jump on this. I don't know, and I've worked in safeguarding and child protection forever. I cannot find another area of child protection where adults' freedoms trump the rights of children to protection. It makes absolutely no sense to me. And it's a bit like child sexual abuse. The collective silence around child sexual abuse only serves the perpetrators. And it's the same with pornography. This collective silence and nobody talking about it just means it carries on because everybody's too frightened. We all need, to my mind, and this is probably a bit dramatic, but to my mind, if you're not shouting about it, you're complicit in it. You're walking away. It's like turning your back on any other form of child abuse. Sorry, you got me ranting now.
I got you fired up, but that's okay because I love that notion of it takes a collective effort, and if we're silent, then we are complicit to a degree in this. Very well. Josh, would you like to follow up on Louise's response?
I do. I'm humbled to be next to Heidi and Louise here. So I'll yammer on about like two very different ideas here, things that I want to see. I couldn't possibly add anything more to what Louise said. But I think what I'd like to see, I think we've got processes and pathways in place for what happens when there's like a criminal investigation or an outcry. And on the other end, especially with a lot of the work Culture Reframed's doing, there's a lot of attention on resources for like primary prevention. But there's sort of like a ground in the middle that's still sort of like untouched. And so I don't know if you want to call it like tertiary prevention or just another pathway for children and families to get screening and like safety information, but I want to see that embedded in the programming that already exists. I think I'm not gonna use like the too many cooks metaphor here, but we need to really consolidate like efforts. We don't need a new program. We need to prioritize this in our current programming. And this might be controversial, but and I'm including myself here, we're too old to do this work. So where are like the children in developing our perspective and in developing what our service delivery looks like when we're building this messaging? I think we're starting to hear a lot about getting lived experience from our trauma survivors when we're looking at like criminal perspectives. Yeah, Ethan, you know it. Where's that youth-led perspective? Where are like our 8-year-old focus groups to help develop, what they do when they go on social media, or, help develop how to teach safety to other children? And, it's not a child's responsibility to protect themselves. So, as adults, we'll use their expertise, because they're the real experts, not us, to develop some like amazing groundbreaking programming. Yeah, thank you, Samantha. Youth voices and youth empowerment programs that facilitate them doing the leading. Because if you want to make a real difference, my face is too old already to make that difference for kids. They're going to want it to be from someone who has at least perceived credibility, and that's a peer. So that's what I would like to see, is more child-centered development of programming by children.
Fantastic. I love that. That's such a great idea. And you're right. We need those lived experiences and, kind of take it from them. They are the ones that are being bombarded through social media. They're navigating this terrain. So we do need to use them as expert voices. Heidi, we have a couple of minutes if you'd like to respond on what you might like to see happen in the future with regards to this work.
Yeah, I love that idea, Josh. That's such a great idea. I think that would really go a long way. I think just getting, from my perspective, more buy-in in general from the medical community. I think we're so behind the 8 ball on this, where it's like, when you talk about it with most people in the healthcare world, they're like, we don't need to assess that. We don't want to talk about that. Not our problem. Grab a social worker, whatever it may be, that there is absolutely this disconnect where we feel intimidated by it, or we don't know what to do, or we feel like it's not our problem, or we don't think it's a big deal, or whatever it may be. And so there's almost zero work or framework or anything, I would say, in the medical community around any of this. And so I think if we could get medical providers and healthcare workers in agreement and in understanding what a big deal this is, that would go such a long way.
Perfect. Thank you so much. Now we're going to open it up to our Q&A. We've been getting some questions in here. So I'm going to pose the question and leave it up to the panel to decide, what if you were to talk to parents and caregivers, what are 1 to 2 things that they might say to their children about pornography? It's the number one thing that a parent or caregiver can talk about when they talk about.
One thing real quick, and I think it's not even necessarily like the content the parent will share with their child. It's more about the attitude about it, because more likely than not, the kids probably already watched pornography at this point. So it just has to be acceptance based. It can't be like, I mean, we all know like the horrors pornography plays on like the developing mind, but we can't lead with that, right? So I think you know, I'm gonna steal some of Ethan Hibbard's brilliance. We've been chatting too. You know, make sure parents have that harm reduction mentality when they're hosting conversations with their kids, so we don't push them away and back into the arms of, you know, more harmful sources.
Mm-hmm. Absolutely.
And I always think that we're quite good at losing sight of the fact that these children are mostly visibly relieved when somebody talks to them about it, because they're not going to come to us and say, do you know what, this is what I've seen and this is what I'm a bit worried about. They're looking for us to be the adults in the room and say, you might see some stuff. How did it make you feel?
Right. Absolutely. It's so important. Another question we have is, how does access to movies and programming on Netflix and other streaming services that have sexual content but is not deemed technically pornography, how does that play into the normalizing of these acts that you're seeing? If you're getting, Heidi, I know that you mentioned people are, kids are reporting that they're seeing these things on TV shows and social media platforms. So how does that play into that if they're not defining it as that?
Yeah, I think from my perspective, it's, even if it's not being called pornography, at the very basis of it, what kids are learning from it is people are sexual objects, and it's fine to take your clothes off, and it's okay for this to be filmed, like very much normalizing those messages that they're also seeing in pornography, which is very desensitizing. And then when people ask for those things, send me a picture, send me a video, there's not red flags going up with kids of saying, I shouldn't be doing that. It's like, well, everyone else is doing it and I'm watching it on Netflix, and I'm seeing it online, so okay, no big deal.
Josh, I knew you were gonna.
I'm gonna say something about everything, Mandy.
No, go ahead.
No, like it's not even about the material that might be present in a Netflix show. It's about anything. Like PG, whether it's Cocomelon or whether it's Black Mirror or and everything in between, like parental involvement, right? We should be encouraging parents to talk about content with their kids no matter what it is. But I mean, especially if we have an idea that there's like sensitive material involved. So that's just my only thing. I mean, we get focused a lot on like these issues at hand, but we should encourage communication between parents and children, generally speaking, for everything.
Right. Absolutely. Okay, so I know that Louise mentioned comprehensive RSE, or relationship and sexuality education, and that's something that the audience has been saying they've been doing some research on and trying to get that implemented because it isn't mandatory in the United States. And we know the benefits of that comprehensive sexual education. And based on what you said, Louise, is there any methodology that we could implement to ensure that sex educators are safe and will not be using porn as an education tool? So the question is about maintaining consistency throughout that porn critical sex education.
Yeah, I mean, I think what you've developed in Culture Reframed is spot on. It's how you, and it comes down to governance, doesn't it? It comes down to legislation. there's got to be agreement that every child should be getting an equitable education, service, and delivered by people who know what they're talking about and aren't influenced by the various ideologies around pornography and whether or not it's sex positive, whether or not it's this, that, or the other. I think the program that you've developed is spot on, because it does exactly that. How you get it mandated to every child on planet Earth, I don't know, but if you figure out a way of doing it, you've got my full support.
Yes, that's what we would like to do. What about implementing it in terms of child advocacy centers and work? Do you see where programs like what Culture Reframed developed for their programming towards parents about having those critical conversations and reducing risk, can they be used as a prevention tool in the CACs and your work in the multidisciplinary teams?
Is that for Josh?
I'd assume that one was pitched for me.
Yeah.
I wish my answer wasn't as simple as yes. I think like yes, but it's all about capacity. It's about like staffing support. I think a CAC at this point isn't required to do prevention work. So not every program is involved in prevention, but those that are and have already built that into their structure certainly have the capacity to lift up programs like this. It's about prioritization, right?
Right. Absolutely. And Heidi, what about in your work? Do you see obviously you recognize the call for comprehensive sex ed in your work, but making that connection on why that's so important, do you see that play out in your work as well? Like if some of these kids and these parents were to have that critical porn lens, how might things be different, or what changes might you see?
Yeah, oh, absolutely. I think it would be huge, especially when I think about, primarily the victims that we serve are female. And they, for the most part, because no one has talked to them about pornography, sometimes they aren't getting any kind of sex ed. They don't understand what healthy relationships look like, what consent is truly. And so a lot of times when we're seeing them, they're saying things that are very confusing because they don't fully understand. Part of them knows, okay, I was sexually assaulted, but then I don't know how to make sense of these other things. So to give you an example, we see so many teenage girls who think strangulation is normal because they're watching it in pornography. And so they won't tell us they were sexually assaulted during, or they won't tell us they were strangled during a sexual assault because they don't view that as part of their assault. So we've learned we have to specifically ask about strangulation, or a lot of times they won't say, like, it doesn't even cross their mind as this is not a normal thing that should be happening. And so just even those things of to have sex education where, hey, let's talk about strangulation, let's talk about these things, I think they would have a foundation for what is happening, what's healthy, what's not. And right now, a lot of kids don't have this. It's very, very confusing for them.
Right. Absolutely. Absolutely. I would maybe like to ask you for my own personal knowledge too, if you had unlimited resources, unlimited political will to do anything that you wanted to do to really make a difference in this area and address the harms of pornography on young people, what would you do? You have a full budget from me. I grant you that. I know this is a thinker.
I guess what comes to mind for me, first of all, I mean, there's so many things, but I think if there was a way to mandate for professionals to have to learn about this and make these connections, I think that would start to change some of the tide that we're seeing. Like if all of our social workers, all of our caseworkers, all of our forensic interviewers, all of our healthcare workers, teachers, if everyone had to start to have this type of education around this, I think it would change so many things that we're seeing, and people would start to make the connections of like, oh, this is influencing this. We need to address pornography exposure. Right now, there's just what I'm seeing is just adults' heads are in the sand and kids are just struggling on their own.
I wouldn't use any of that money for any of my own programming. I would
course.
throw it all into like the pathways that have already been built for us. We've already talked about like the insidious nature of like how pornography has proliferated in society, but it's actually demonstrated a pretty great pathway for us too, right? So why don't we just use that pathway for good? And we'll flood social media, we'll flood content with some of these more positive and like healthier mindsets. You know, get Netflix to write it into their shows. Make sure that it's as that we have exposure to this information as widespread as the exposure to pornography. That might literally be the only way to really counter impact.
Absolutely.
May I say something?
Yeah.
Just listening when you said that an unlimited budget, and I looked at everybody's faces and it was like, what?
What was that?
I think what we've said here today in this panel, we've come up with some excellent ideas if we had the budget, is that all the stakeholders, from the public health stakeholders through to having kids doing their own, also working with them, to having trainings for teachers, for health professionals. I mean, I think we know what the pieces are. The issue is that we are ahead of our time in this, is that we are where you had, I would say, domestic violence 20 years ago, where you knew it was happening. You knew she had a broken arm, a black eye, but it was a family private thing. And then all of a sudden it just tipped into a public health approach, understanding it. And I think we're on the precipice of that now. So I think that we have the ideas. I think what we lack is the budget, because and part of getting that is building awareness that we're doing, is that this is not something to bury your head in the sand. We have to do this. There is no alternative. So just thinking of all the ideas that you pulled together today was extremely impressive of what we could do. Now we just need the budget.
Absolutely. So we have a couple minutes just to wrap up. If anyone would like to give some final words, anything that wasn't addressed or any important points that you want us to take home.
Shall I go first?
Yeah, sure, Louise.
I think one of the things that I think a lot of people in charge of legislation, people writing policies, writing laws, they forget to join the dots. So when you have, like in the UK, we have a serious violence strategy, but sexual offences are not included in the serious violence strategy. You have a domestic abuse act. You have violence against women and girls strategy, but child sexual abuse is not included in the violence against women and girls strategy. So all of these things are being looked at in silos, and there's good work going on. But when you drill down, the root cause is the same for all of them. And pornography, for me, feeds that root cause, because it breeds and it flourishes entitlement, violence, misogyny, and everything else. It's almost like it's the petri dish from where everything else is growing. And I think we're missing a trick looking at all of these different forms of violence against women and girls, violence against women and children, serious violence. I think we're missing a trick looking at them all as individual issues.
Mm-hmm. Absolutely. Heidi, Josh, you got a 20-second pitch for us?
Don't do this work by yourself. Do it as a team so you don't drown. Multidisciplinary collaboration will be the key to success, however incremental. So find those folk in your state who are interested or already committed to doing this work, or find those folk, wherever you are, that already have, some level of awareness and mobilization towards doing work in this space, so you can work together.